All right, that sounds good. Okay, well, I am happy to see that we have some wonderful partners on our call today. We have Michael Becker from MSU. We have Danika from Bozeman Health. We also have Kallie from Bozeman Health, and we're also joined by Dr. Henyon as well from Bozeman Health. So I will go ahead and get started and just briefly share my screen. And we will talk about our surveillance report as soon as I can find it. Sorry, everyone, it was all queued up. That's usually how that goes. Why can't I find it today? We have too many windows open. Huh, there it is. Too many windows open. Sorry about that, everyone. Oh, wrong one. This is a good start, right, everyone? Let's stop. Let's try this again. Aha, there we go. Okay, sorry about that, everyone. Thanks for your patience. Okay, so we'll go ahead and get started with our surveillance report for this week. As you can see, we are continuing to see a decline in our 7-day rolling average of cases per 100,000 Gallatin County residents. This continues to be good news, and I anticipate as long as we continue to do the work we're doing, that this should continue. Also wanted to share with you the 7-day average percent positivity rate here in Gallatin County. Again, just as a friendly reminder, this red line is the one we're trying to stay below. And even further below that is our 5%, which is that criteria set by the World Health Organization for reopening businesses. And you can see we continue to be below that as well. So again, that continues to be good news. I also wanted to share with you that, again, for that specimen collection being reported to public health, we continue to see those testing results come back in a rapid time frame. So we're able to really get right on those cases as soon as they're reported to public health. And so that median collection to reporting to us is 1 day, which again is great news. And also, we have focused a lot on our contact tracing efforts. So as long as we've been able to kind of sit in this range where we're able to investigate a case quickly, again, that's important for reducing transmission. We've been able to continue to keep up with that and really start those investigations within a day. I've shared this graph before, and Matt has shared this graph before. Really, we are seeing this leveling off here, which is good news. And, for the most part, again, we still see that the vast majority of those cases were in that younger age group and those younger age demographics. But again, just as our cases are leveling off, so are obviously the age groups reported per cases as well. So I'm going to stop sharing this screen. Great. And I wanted to spend a little bit of time talking today to all of you, because we have been getting a lot of questions lately about variants and just about vaccine hesitancy and just generally what we're doing as it relates to both. So when you think about variants, there are variants that have been detected in Montana and in Gallatin County. And really, this isn't surprising that these variants are here. And the state is reporting that the majority of the detected variants are really what it's called the UK variants, and that we are seeing the Delta variant here in Montana. And the identification of these variants in Montana and Gallatin County should really continue to serve as a reminder of how important it is to continue to take those everyday precautions, like staying home when you're sick, washing your hands, and also getting that vaccine. The state also has a report that I will share with all of you that comes out every week. And they've included the statewide variant numbers. And for the statewide level, 10% of the UK variant cases that have been detected have been hospitalized or were hospitalized on that statewide level. And thus far, there are no current reported hospitalizations for the Delta variant. So what that means to us and to the state is that the vaccines do look like they're doing a pretty good job against the variants. We also have looked at our hospitalization numbers as it relates to Gallatin County residents hospitalized since April 1st of this year. And out of the 64 that have been hospitalized for COVID-19 related disease, 3 have been fully vaccinated. So again, when we talk about fully vaccinated, that means having 2 weeks past that final dose, whether it be Johnson & Johnson or Pfizer. So that means that 90% of the hospitalizations are unvaccinated. Last week, I shared with all of you our Montana and Gallatin County specific vaccine update graphs. Unfortunately, there's been a bit of a delay in receiving those graphs this week, but we will, as soon as we have them, we'll share them out. But what I wanted to talk to you guys about this week, and why we've brought the partners here today too, is to talk about the targets that we have just generally. And it's an aspirational target that you've heard the state talk about. You may have heard talk about nationally, which is that 70% of eligible individuals with at least 1 dose of COVID-19 vaccine by July 4th. And again, this is an aspirational goal. It really helps us drive progress in a short period of time. And it really does take a huge collective effort. And we really have made significant progress. And I want to be certain that we celebrate that as well. I would also caution that if we and when we hit this target, we shouldn't really consider ourselves done. Our work won't stop once we hit 70%. There's still ongoing effort to continue to vaccinate individuals. So as I said before, we really have made some significant and amazing progress to meet or exceed that 70% goal in certain age demographics, and specifically in our older demographics. And this is really a remarkable achievement thanks to the many individuals in our community who have rolled up their sleeves and received a vaccine, and of course the many partners who have contributed to administering vaccines. And as you recall, when those vaccine was rolled out, the most vulnerable and at risk were prioritized. And these individuals were really tragically a majority of the COVID-19 deaths. And many of all the recent data that we have available to us shows that we have reached that target in the age groups of 60 and over with at least 1 dose. And that, again, I just want to reiterate, that's life-saving work, and we should celebrate that. I will also say we do have work to do in the age demographics of 50 and younger, particularly in our youngest age groups. And, the reality here is that many of the younger adults may have felt that COVID-19 was not something that immediately impacted them, which may mean that they're less eager to get a vaccine at this time. And as I said before, with the variants and the good efficacy of vaccines with these variants, it remains important to get vaccinated. And so we really are truly all in this together. Again, I mentioned that both Mike and Kallie and Dr. Henyon and Danika are here today because I want them to talk about their work and ongoing effort to continue to increase the vaccine uptake in the community. So I don't know who wants to kick it off, if it's Bozeman Health or Mike from MSU, but I'll turn it over to you.
Mike, would you like to start, or would you like us to go ahead?
I'll be happy to go first. That's
great.
Fine. Thanks for having Montana State on the call. I can give you a rundown of where we are with what we're doing to communicate to students about vaccines and our efforts here on campus. So we have made concerted efforts to reach out to all of our students who are currently on campus, as well as students who are away from campus for the summer and not attending MSU currently. We continue to refresh our social media graphics and our digital graphics and all of the other assets that we have here on campus for that limited audience that's here right now. And for social media, for the audience and followers we have all around the country and around the world. So those graphics are updated and the messages are refreshed very regularly, weekly, if we can help it. We are also doing direct mailings to our 16,000 plus students with postcards encouraging them to get vaccines where they are this summer, whether that's in Bozeman or around the country and around the world. We've sent out one collection of 16,000 cards, and we have another mailing coming up in the next couple of weeks to reinforce that message, especially as we get into the middle of summer and folks need to start thinking about getting vaccinated before they come back if they're going to choose to get vaccinated. We have, in coordination with other campuses around the state, been offering town pump gift cards to students who do choose to get vaccinated. And all they have to do is, for us here in Bozeman, come to our student union building with their proof of vaccination, and they are given this incentive. And we have seen a little bit of uptake on that, about 250 cards given out over the course of that promotion. And that is, of course, going to continue all summer. Granted, we do have fewer numbers of people on campus to take part of that in person, but we are hoping that it will convince a few more people to take advantage of the opportunities. And also at MSU, we continue to offer our vaccinations at our stadium testing site, as well as at University Health Partners on campus. Those vaccinations are available for students, faculty, and staff free of charge. On campus in total, the numbers tell me that we've done approximately 4,600 vaccinations altogether. And this month in June, we're averaging about 30 per week. So pretty steady bit of traffic there, not zero, which is a good thing. So that's my update.
Great. Well, I'll kick us off for Bozeman Health. Thank you, Lori and Michael, for the updates. I'll start off by just reminding everyone that we've fully transitioned to administering vaccines within a specialized vaccine clinic, which is at entrance 4. We've moved away from using our main hospital entrance at entrance 1, and we are now administering vaccines at entrance 4. We are seeing a typical average daily vaccine administration of around 80 for both first and second doses combined, which is significantly lower than April and May, which at its height was around 700 per day. And just a reminder as well, anyone in the community, both established patients and non-established, or both established patients and non-established individuals, can schedule vaccines by calling our COVID hotline, and that's 414-2619, or by visiting our bozemanhealth.org website. We continue to work with leaders throughout our health system to identify ways to expand access to the vaccine. Right now, we're exploring options for hospitalized patients to receive it while they're here, if they haven't already. We're exploring giving access to the vaccine during scheduled clinic visits. And we have partnered with other local outreach organizations to use the Mobile Healthcare Connections bus. And Danika Comey, who's on here, can provide additional information regarding our previous and our upcoming activity with that. We have partnered with our pediatricians and our other family practice physicians and providers to equip ourselves with information surrounding vaccinating adolescents. And we are very excited to be working with our patients to get our younger populations vaccinated. We encourage anyone who has not received a vaccine and is interested in either obtaining more information or obtaining a vaccine to reach out to their healthcare provider to have a discussion about their particular health situation and whether it might be important for them to receive it or not. And with that, we, as far as vaccines go, although we are seeing a decrease in administrations, we are still seeing a good steady amount of administrations, and we're very hopeful with that. Our census at the hospital has remained relatively low, and that has been of help and of a good indicator for the community as well. And I am very excited to have Dr. Pepper Henyon here to answer any questions you may have regarding vaccines and pediatrics. And I'm very glad to have Danika Comey here to discuss our outreach efforts with the Mobile Healthcare Connections bus. So Dr. Henyon, do you have anything you'd like to say?
I guess there's a lot of things I could say. I guess maybe I should ask, what questions are there for me?
Sure. And if there aren't any questions yet, looks like we may have a question.
I guess I could ask a question. I'm Juliana, I'm from the Chronicle. Hello, everyone. Thanks for taking the time for us. I'm curious, Dr. Henyon, if in speaking with parents, if you've seen that the biggest hesitancy is just being unsure of whether this is safe for children, or what is kind of the biggest barrier to getting children vaccinated?
Yeah, that's a great question, and thanks for asking it. You know, so I've been a pediatrician here for 20 years, and I think that with any new vaccine, parents always question, is this the right thing? Is it safe? That sort of thing. And with this once in a century pandemic thing happening, we now have this new vaccine. And while it has been studied very well, and there are actually 4 vaccine safety monitoring systems in place that are watching for the safety of this vaccine, you know, there's still a little bit of unknown with it and kind of what that's going to look like. And for our kids, you know, we don't ever want to do anything that would potentially harm them. And I think that one thing that I feel very comfortable about is with these vaccine safety monitoring systems, that we are really able to continue to watch for anything that might pop up. So people have talked about the emergency use authorization, and that has been one thing that parents have really worried about. Has it really gone through the whole process of how a vaccine is typically made and studied before it's actually released? And really, I'm happy to report that everything has happened as it normally would with any other vaccine. It's just really happened at a faster rate. And the thing that we have not had the opportunity is just time to kind of see what, if anything, will evolve as potential side effects from the medication. There's been concerns by families that it could potentially affect a child's fertility. And what I'm also happy to report is that there is absolutely no evidence that that would be the case. With the mechanism of action of how the vaccines work, it's just not biologically plausible that it would do anything like that. And also historically, it has been very common with any new vaccine that's come out that people have had that concern. And with all the other vaccines that we traditionally give to children, that's never been an issue as well. I'm trying to think what other concerns families have. People worry that it hasn't been given to enough people. But what I would say is that it's been remarkable how many kids in the United States have received this vaccination. As of this past week, 7.7 million children in the United States have received at least one dose of the vaccine. And these are kids less than 18 years of age. And 5.4 million of these children are fully vaccinated. So the benefit to having such a large number of kids is that we are really able to monitor for rare adverse consequences. Then more recently, probably some of you have seen, is that there's been a question or concern about the vaccine being associated with myocarditis or pericarditis. And those diagnoses, myocarditis is an inflammation of the heart muscle, and pericarditis is an inflammation of the lining around the heart. Now, there are kids around the country that do develop myocarditis or pericarditis just in general. There's many things that can cause that, although it is rare. Typically, the incidence of myocarditis in the kids occurs in about 1.8 per 100,000 kids per year. And that's looking at the more typical group, which is about 15 to 18 years of age. So looking at these adverse reactions that we're seeing, there does appear to be a temporal relation with a developing myocarditis or pericarditis with the vaccine. And it's likely just the mRNA vaccines, although we don't really know because there are no other vaccines at this time approved for kids less than 18, other than the Pfizer BioNTech mRNA vaccination. But the important thing for people to know is that the rate of myocarditis or pericarditis is extremely low. It's extremely rare. And the rate is about 18 cases in 1 million doses. So it's extraordinarily rare. What we're finding out is that boys are more likely to be affected than girls, and especially kids within the 16 to 24 year age range. So for girls, their risk is more like 9 in 1 million doses. And then for the boys, it could be up to 66 in 1 million doses. But again, it's still extremely rare. And then the other thing we have to think about is that there are real complications that kids are experiencing when they actually get COVID. And there have been kids that have died from COVID. And the majority of the kids that have died have been kids that have been unvaccinated or unable to be vaccinated. Let me just pull up some numbers here for you. You know, as in the past, up to the past week, there have been, let me get the number here. Here we go. So it's 324 children in the United States have died from COVID who are less than 18 years of age. Now, if we think about influenza, and every year there are children and of course adults, and I'm just a pediatrician, so I don't ever talk about adults. I don't know anything about them. But when we talk about influenza, this rate of death for COVID is two to 3 times more than what we see with influenza. And honestly, if we didn't have all these adults dying from COVID, this would be national headlines that all these kids are dying from COVID. But because all of these hundreds of thousands of deaths in adults are having, that's been kind of taking up the news more so than just the kids. So kids can develop myocarditis and pericarditis. They can develop a multi-system inflammatory syndrome. And it's interesting to know that for kids that develop it, they're about 60 to 70% of those kids that develop the multi-system inflammatory system, they end up having to go into the intensive care unit. They're very sick. They can end up on the ventilator. They can end up on multiple medications just to help their heart continue pumping. And then 1 to 2% of those kids actually die. So as we think about the side effects to the medications or to the vaccine, we really, really have to remember that COVID, while most of our children have done fine with it, there are a number of kids that it has severely affected them. And the big question for me, I wonder is, you know, when kids have been this sick, what does this mean for the rest of their life? You know, we don't know. Could it be that they'll be completely fine? Could it be that these kids could have some heart damage that could stay with them and potentially decrease their life expectancy? And so I think as we think about side effects and vaccine hesitancy, in this discussion, we also really have to be talking about what does COVID look like for kids? I don't know, so I've talked a lot. Maybe that's way too much information, but hopefully that's helpful.
That was excellent.
Yeah, you answered some of the follow-up questions I'd been writing down as you kept going. So that was awesome.
Oh, good. I think I was reading your mind.
That's a pretty cool superpower. That must come in handy as a pediatrician. I think you kind of already answered it, but do you think that people are more hesitant to vaccinate children than to vaccinate themselves as adults? I mean, you kind of already summed that up, but.
Yeah, I am seeing that. You know, it's interesting. It seems like a lot of the parents have really jumped on board. And also, I mean, I'll have to tell you, there's a lot of people that are totally on board with vaccinating their kids. You know, it's not just like every single patient. I think that the majority of people are very excited to get their kids immunized. But I think that when it comes to your kids, right, you just don't want to do the wrong thing. And so people are pausing, they're hesitating. They're coming in and asking me, gosh, what do you think? You know, and right now our vaccine is approved for kids 12 years and older. And there are studies ongoing right now to look at our younger children. And there's some discussion that maybe by the fall, kids 5 and older may be able to get the vaccine. And so families are saying, well, what do you think? And I said, well, I don't know. I'm not going to really comment on it until I see the safety data. I expect that it's going to be great, but I'm not going to be on board until we really know for sure. And especially as we dip down into the much younger kids, you know, kids 6 months of age and older, there's some studies ongoing with that too. With our littlest children, the vaccine manufacturers will take even more time to study to know for sure what dose of vaccine is appropriate for a small child, and then to watch even longer for side effects, that sort of thing.
Do you think that there might be more uptake for vaccines when we get back to school, and it might just be that during the summer, you know, parents aren't as concerned about vaccinating their children?
Yeah, I think that's a good question. It's hard to predict. Gosh, I wish I had a crystal ball. Maybe I can read minds, but I don't have a crystal ball. That's for sure. No, I really can't read minds. I gotta like make sure that doesn't get printed. Take that off the record. I'm just kidding.
It is so stricken off the record.
Thank you so much. So I think that it's a good question, right? Because, and Lori, correct me if I'm wrong here, but if you've been, at least at this point in time, if you've been vaccinated and you're exposed, you don't have to quarantine. And so that's really big, right? Because if you have to quarantine, you have to take your kiddo out of school, right? And they're missing out, even though our school districts have done an amazing job this year. So it certainly could be an impetus for families to want to vaccinate their kids. It'll be nice too to see, we'll just have a little bit more time with the vaccine, and hopefully over time, as people are just becoming more comfortable with it, we'll have a bigger uptake. I've seen that historically with vaccines, as a new vaccine comes out, there's more hesitancy. And then as we continue to use it and people realize that it's very safe, then it's a much easier time, you know, educating folks and then having them, you know, feel like it is the right thing for their child.
Awesome. I think so far those are my questions for you.
I guess one other tagline I want to say to you guys too is that right now, COVID-19 is one of the top 10 causes of death for children in the United States. And we have an ability to prevent that. So that's a really important thing for our families to know, you know, for our children 12 and older, is that we can actually prevent one of the top 10 causes of death in children right now. It's hard to say that, right? Kids die from accidents, kids die from cancer, but to be able to prevent it, it's pretty powerful, pretty exciting.
Thank you, Dr. Henyon. Kallie, should we kick it over to Danika as well?
That would be great. Yes. Thank you so much, Dr. Henyon. That was extremely powerful information, and coming from someone so well respected. I really appreciate that. Danika, if you just want to share our past offerings through the Mobile Healthcare Connections Bus, and then what we have upcoming, that would be great.
Absolutely. Hi, everyone. I do have a couple slides, if that's okay, that I can share. Alrighty. Can everybody see my screen? Thumbs up. Okay, wonderful. Okay. This will just be really brief, but thank you all for inviting me here today. I'm really excited to give a quick update on Bozeman Health's mobile screening and mobile program, which we call Healthcare Connections. My name's Danika. I work at Bozeman Health as the Community Engagement Coordinator, and a big part of my role here is coordinating this program. So usually we use Healthcare Connections to do prevention programming in Madison, Gallatin, and Park counties. We do a series of free, and all of our services are free. We do a series of free immunizations, including flu shots. We do some pre-diabetes screens, blood pressure, and then we have a provider on the bus that can chat through test results. Starting in April, we got COVID vaccines on the bus, and it was a very natural plug to have them on the program because we can bring COVID shots to populations and to our more rural populations. So to date, we have given 139 Pfizer vaccinations and 63 Johnson & Johnson vaccinations. Like I said, we began at the end of April, and that was when the FDA hold was in place for Johnson & Johnson. So we only had Pfizer, and we wanted to get COVID vaccines out into the community. So we had been planning for Johnson & Johnson, but at that point we were like, we need to get something out there. Now, or after our first 2 clinics, we switched to Johnson & Johnson, and moving forward in 2021, we will be giving only Johnson & Johnson on the bus. We are being really strategic about reaching out to folks in the community who have historically had access or barriers accessing healthcare. So a couple examples of that are folks who are prohibited from getting a COVID vaccine because it's very difficult for them to go for like traditional office hours to see their primary care provider. To address that, the Healthcare Connections schedule, we're being really intentional about providing free COVID shots in the evenings and free COVID shots on weekends for those folks who have those challenges with office hours. We're also in our data that we collect about barriers to accessing healthcare, we see that our more rural populations report that it's challenging to drive all the way into Bozeman or perhaps Belgrade to get a COVID vaccine or to get any healthcare. And so with the mobile program, we can now bring services to those more rural populations. They don't have to take time off work. They don't have to spend an hour each way driving to come see us. And so that's another way that we're decreasing barriers. We're also partnering with a lot of local community partners to provide free COVID shots to some of our more underrepresented members of our community. So for example, the Spanish speaking community, we did a special Healthcare Connections stop where all of our staff had either an interpreter or spoke Spanish themselves, and we were able to provide COVID vaccines to our Spanish speaking population. Some of the location stops that we've been to this spring include the Wagon Wheel Trailer Community, Gallatin Valley Food Bank, Rose Hours, Drinking Horse Trailhead, Gardner, and Gallatin Gateway. So moving forward, our schedule is really an attempt to go where there might be challenges for people to reach COVID vaccines in the traditional sense, and that we're trying to reach the populations with the lowest levels of vaccination rates, which according to the data right now, we're trying to really specifically target young adults aged 18 to 24, our rural populations, and then still being mindful about including our working populations by providing those evening hours and weekend hours. So as you can see from our schedule for June, July, August, and September, a lot of the stops that we're going to be at include stops where we think a lot of young folks will be hanging out at. And our goal is to bring Healthcare Connections to where people already are, bring it to the rural communities, bring it to where people are gathering, and being mindful about, again, weekend hours and evening hours. Moving forward, we will only have Johnson & Johnson. We're seeing a really positive response from our community at this point. We have had people commute from other spots in the county to come get their COVID shot on Healthcare Connections so that they can get the Johnson & Johnson shot. People talk about if they have to take time off work, or if they're going to get a little fatigued or not feel so well after their shot, they only want to miss work once. And so they don't want to come back for a second shot and have to get that scheduled and feel maybe not so well again a second time. So that's really cool. We're seeing a really positive response to Johnson & Johnson. Moving forward, all these upcoming appointments are free, and there's no need to make an appointment. So folks can just show up and we'll give them a COVID shot. The specifics about where we will be when, the dates and the times, and more specifics on where we will be parked are on our website, which is bozemanhealth.org/healthcare connections. And if there's time, I'm happy to take any questions.
I have a quick question. Has there been any effort either through Bozeman Health or even the county to try to get to some of the really far-flung places in our county, like West Yellowstone and other really hyper rural areas where it's definitely very hard for people to come to Bozeman to get healthcare?
Yeah, I can jump in, and Kallie, you can jump in if I forget anything. But yes, there has been a really big effort. I don't know if you saw like Willow Creek's on there. They have some of the lower vaccination rates by zip code. We try to be very strategic about working with our partners in our more rural communities. So asking, hey, would it be helpful if Healthcare Connections came to West Yellowstone? And that's a great example. Community health partners and the team down there said, you know what, we're actually doing really good on vaccination rates right now in West. We don't need you at this point, but we're still in contact. If perhaps this fall they want us to come down to help with the clinic in the fall, we'll be happy to come. But as of right now, they said, you know what, we're doing great. So it really depends on where we're going. We like to reach out and make sure that that we are adding to the community and that we are welcome and that we it's a great spot for us to be.
Yeah, I'll just piggyback on that a little bit too. We have seen very similar information coming out of West Yellowstone, CHP, and then also Shane Grube out of the Hebgen Area Fire District. They really did a remarkable job and also reached out to the Latinx community there. So encouraging really as much as we could to encourage people to get vaccinated in West Yellowstone. We'll continue to assess that, working with them very closely to identify other opportunities. Like I said in the beginning, just because it appears we're done, we're going to keep working at it because we know how important it is to continue to get people vaccinated and have that available as well. So again, I would agree with Danika's assessment, and also just adding that we'll continue to work on assessing how what the needs are of West Yellowstone and other communities. Are there any other questions?
Hi, Lori. This is Emma Wolforst with NBC Montana. I had a question for you, kind of circling back to, I know you talked a little bit about the variants and some of the information there. So I saw the newest report that came out from DPHHS. Obviously, like you were saying, not a huge level of hospitalizations with some of the cases and low death rates. But it says in this final table that a really high percentage of these breakthrough cases have been variants. So is there any concern there that even though we have really good vaccination rates and things like that, that a lot of those breakthrough cases are coming through the variants, and there could be an increase in variants in the state going forward?
Yeah, good question. I can't speak to you and I have seen the same state report as it relates to the number of variants detected in those breakthrough cases. I think it's really important to remember that of those that they tested, we don't do sequencing on all of the breakthrough cases. So the proportion is small overall. So keeping in mind, like I said, that not every breakthrough case is tested for the variant. And so even locally here, when we've looked at our numbers, we've seen about 9 variants that have been detected through those breakthrough cases here in Gallatin County since April, or excuse me, since January, when we were looking at those breakthrough cases. And I think it's important to just remember that it's always possible. There could always be a breakthrough, through a vaccination effort. So I guess to try and answer your question, variants are going to continue to be something where we should all be watching and continuing to do all we can to encourage our others, our loved ones, our community members to get vaccinated when we can.
Great, thank you so much. And just one other follow-up, as you mentioned, variants are something we're going to keep watching going forward. Is there any thought about the fact that obviously Gallatin County, we have a really high population, we have Bozeman, which is a growing city, and now that we're into the summer and things are opening up, we have the busiest airport in the state. So is there anything the health department is looking to do now, just as we open back up and there's most likely going to be an influx of people from out of state coming here into the county?
Not anything specifically that the county is going to do differently, and we're going to continue to encourage the everyday precautions and continue to encourage people to get vaccinated. And again, along with all of our partners, finding ways to make getting a vaccine the easy choice, and making it available as many places as we possibly can. So, and in terms of anything specific, nothing specific other than continuing to keep an eye on it, continue to monitoring the number of cases overall, breakthrough cases, hospitalizations, and that's not only just a county-wide effort, that's a statewide and nationwide effort.
Great, thank you so much.
You're welcome, thank you.
If it's okay, a couple of other thoughts about the variants. So, talking about the UK variant, that's also called the Alpha variant, that variant is 40% more transmissible than the original strain of COVID. And now we're looking at the Delta variant, and that is actually 60% more transmissible than the Alpha variant was. So this thing is very transmissible. The question is it going to cause more severe disease? And there was a Scottish study that showed that it does seem like it's more severe, but it's not really clear, honestly. I hope the public is taking part in science right now. And I think that's what's so hard, is that in science, there's a study that shows one thing, and then the second study comes out and shows the exact opposite. And so then we need a larger, bigger study to really determine what the answer is. And so when the poor public is looking, they're arguing, and they're both talking about a study, right? So I think what's hard is that our public hasn't had to have the patience that typically we do as scientists to really wait for the good data to come out and to kind of think about what questions we want to ask and that sort of thing. So as far as is it going to be more severe? Possibly, possibly not. But here's the good news, is that the vaccine is really doing a good job preventing the Delta variant. And it's another plug for really trying to get people vaccinated. What's interesting, down in Colorado, the Delta variant was very, very small. And over the course of several weeks, now it's like 75% of the COVID cases are through the Delta variant. So it's really amazing from a geeky medical person to, see how fast something like that can really change. And here's also the deal, is that we need humans to allow the variants to come on, meaning that if we continue to be unvaccinated, variants will continue to evolve. But if we can really get people vaccinated, we can really cut down on the opportunity for this virus to mutate and have different variants. So again, just, I'm a vaccine person, right? So just another plug to really think about in our community how all of us really could convince everybody to get vaccinated.
Thank you so much.
Any other questions today? Okay, well, I cannot say thank you enough to everyone who joined us today. I really appreciate the collaboration and the vast knowledge that everyone shared here today. So thank you for that, and the good questions as well from Juliana and Emma. And we will see you all again soon. Take care, everyone.